This is a WDIO News Special Report.
Be advised that this call is being recorded. If you require any further assistance, you may press *0. And without further ado, I would like to welcome your host for today, Mr. Mike Schumer. Sir, the floor is yours.
Thank you for joining us for the COVID-19 media call for February 16th. We'll start today's call with a situation update from Health Commissioner Jan Malcolm and Infectious Disease Director Chris Erzman. We'll then open up for questions on the line. With that, we'll now turn it over to Commissioner Malcolm.
Thank you, Mike, and good afternoon, everyone. It's been several days since we were together, so we'll do a situation update over the last few days. We've not talked recently about the global and national totals, so very quickly, around the world, we are now above 109 million cases, still continuing to grow by many hundreds of thousands of cases a day, and over 2.4 million deaths worldwide. In the United States, we are above 27.5 million cases now. Recent days have seen a slight improvement in the numbers of new cases and deaths per day, but still at extraordinarily high levels of activity. Here in Minnesota, we reported 961 cases on Saturday, 770 on Sunday, 607 Monday, and 456 cases today. This brings us to a new cumulative total of 474,621 Minnesotans who've had confirmed cases of COVID since the start of the pandemic. The 456 new cases that we reported today came on a testing volume of 9,333 lab tests. This is one of the lower lab numbers that we have seen in quite a while, but still obviously wasn't too long ago that we were pretty excited by a 10,000 test day. However, the weekly change in both cases and testing continues to come down a bit from week to week. But the good news is the 7-day average test positivity rate is remaining below our caution level, which, as you remember, is 5% of tests coming back positive. The 7-day rolling average is now at 3.8%. I'd like to point out continued really encouraging progress in the number of cases that we are seeing in long-term care settings, particularly in skilled nursing facilities or nursing homes, which was the first priority group for immunization, as you'll recall. Looking at the most recent weekly data, we had just 15 cases reported in nursing homes. Even over the summer, when we were in a much, much better shape with long-term care, the numbers were well over this level. In fact, the last time we saw case numbers this low on a weekly basis was back in March, at the very beginning of the pandemic in Minnesota. Now, our goal is absolutely to get the number of cases, hospitalizations, and certainly deaths due to COVID-19 down to zero. And we see evidence that the vaccines are helping bring those numbers even further below where we have been. We want to give a lot of credit to facility staff, their nursing staff, their care staff, their administrators, and certainly to the residents and the families in these facilities who have endured so much and worked so hard, as well to our local public health partners and folks at the State Department of Health who have worked tirelessly over this last year to help strengthen infection prevention and other safety measures in those settings. We reported an additional number of deaths over the holiday weekend, 7 deaths on Saturday, 7 on Sunday, 2 on Monday, and another 2 deaths that we reported this morning, bringing us to a new total of 6,380 deaths since the start of the pandemic. There are currently 315 people in Minnesota hospitals being treated for COVID-19. Of those, 57 are in intensive care. On the vaccine administration front, We're now at over 927,000 total vaccine doses that have been administered to Minnesotans and reported into our immunization information system as of Sunday, as shown on the dashboard today. Now, this is both first and second doses combined. We expect that we will reach the 1 million milestone for total doses in the coming week. The number of people who've had at least one vaccine dose is now over 686,000. 240,000 of those people who've had both doses of the vaccine. And with that, I'd like to pass it to Chris Erisman for some additional updates.
Thank you, Commissioner. I just wanted to provide an update on the variants of concern that we recognize are circulating in Minnesota. We've mentioned several times in recent calls about how the positive signs we are seeing in the data for new cases, hospitalizations, and other indicators show real progress in our fight against COVID. But we've also mentioned that we need to keep vigilant to protect the gains we've made against the pandemic. One reason you hear us say this so often is that we remain concerned about the potential impact of the new variant forms of the virus. The latest surveillance numbers that came in this last week bear out this concern. The MDH Public Health Lab surveillance program continues to analyze a random sample of the COVID-positive cases to see what form of the virus they have. While most of the cases are still being caused by the older forms of the virus, we are seeing an uptick in the number of cases associated with the variant originally identified in the UK, or B117. At last count, we had 40 cases of B117, and still the 2 cases of P1 variant that was originally detected in Brazil. The B117 strain is thought to be more easily spread, and there is some concern that it may have a greater likelihood of causing more serious illness. The variants are yet another reason why we need to keep up the simple but effective prevention methods of masking, keeping socially distant, staying home when sick, and getting tested when appropriate. I also want to acknowledge that we sent out an updated piece of guidance today in light of the increasing number of people who've been vaccinated. If someone has completed the COVID-19 vaccination series, so that's 2 doses of the currently approved vaccines, and is later exposed to COVID, they do not need to quarantine if all of the following are true. So just to reiterate, you've had both doses of our currently approved vaccines, you're exposed, then you don't need to quarantine if all of the following are true. 1, that it has been at least 14 days since your last vaccination. So in other words, 14 days since you received the second dose of vaccine. This is so that your body has time to produce immunity against the virus. Then the exposure needs to be within 90 days from your last dose of the vaccination series. As we get more information about how long protection from vaccination lasts, this time period may change, but for now, the exposure needs to be within 90 days of that last dose. And you should not have any symptoms of COVID-19. So if all of those things are true, then you would not need to quarantine. However, if you do have any symptoms, it's important that you quarantine, particularly as we talked about with the new variants. Now, if someone works in a healthcare facility, and this includes long-term care, so assisted living or skilled nursing, and they have been vaccinated, the recommendations for their quarantine from work are different, and they should follow the recommendations for healthcare workers and talk with their supervisor and employee health. And we put out information for these facilities specific to this so that they will have that, but just to acknowledge that for healthcare workers, the quarantine guidance for work are different than for the general public. And then I want to acknowledge that with the storms that are occurring across our country, but in particular in the South, vaccine shipments are delayed this week. So providers are having to reschedule appointments as they learn about the status of their shipments. So I just want people to be aware of that and want to acknowledge that this may impact our timeliness metrics for next week as providers are scrambling to reschedule and plan for this change in when their vaccine arrives. And with that, I'll turn it back to Mike.
Thanks, Chris. Operator, we're ready to take questions.
As a reminder, to ask a question, you will need to press star 1 on your telephone keypad. And if your question has been answered, you may press the pound key to withdraw. Please stand by while we compile the Q&A roster. Our first question comes from the line of Jeremy Olson from the Star Tribune. Your line is open.
Hi, I wanted to circle back and ask you about the CDC's new guidance for school reopenings that was announced last week. Among other things, they said that schools right now aren't the major source of teacher infections or community outbreaks, and they issued new guidance or new statistical guidance for when to reopen schools. But given that, I wondered what's stopping Minnesota right now from throwing open all of our schools, and will we be adopting the new CDC standards rather than our current way of measuring school reopening decisions?
Well, this is Jan. And, as you know, the governor has said as recently as last Friday that he really wants to make it possible for 100% of our kids to be back in school as quickly as that is possible in a safe way. I don't have a specific update for you on that today, but we, along with the governor and certainly the Department of Education in the lead, are reviewing that CDC roadmap from Friday. And hope to have more to share with you soon on that. But we have clearly made important progress against COVID-19, and the measures that have been added to protect educators with more testing, for example, has put us in a good position to get our kids back to school. So I think we appreciate having the new CDC guidance. We are looking at that. We're really pleased to see how many of our younger learners are back in the classroom. So we're definitely taking a look at that right now.
Let me ask a follow-up as well. I mean, whether we're talking about classrooms or other, it's been a while since we've talked about the threat of aerosol or airborne spread of COVID-19. I'm just wondering what your current thinking is on whether that is a threat, and also whether these new variants present any more threat of aerosol spread than perhaps the old ones did.
Chris, could you take that, please?
Sure. So certainly when we talk about the variants, we recognize that they have shown the tendency to be more transmissible than the regular, strain of COVID or SARS-CoV-2. Whether or not that is explicitly due to aerosolization, I don't think we can say, but we do know that these variants are more transmissible and may also be causing more severe disease. And so because of that, I think that it's really important that even as we're celebrating successes, the commissioner talked about our vaccination numbers, which are really positive, the positive, declines in cases in our long-term care settings. I mean, all those things are wonderful, but we have to keep in mind that we have these variants, that they present, a change in the game plan to some extent. And until we learn more about them, we really do have to be cautious. And so your question about aerosols, that may, certainly it could be a way that they are more transmissible, but we don't have any data on that at this point. We just know that there's evidence that these variants are more readily transmissible. And I think the data that I shared today suggests that we're seeing that transmission in Minnesota.
But just to clarify more generally, is aerosol spreads, has it been debunked? Is it still considered a risk? I mean, there was some CDC guidance on that back in the fall, but it was kind of taken back. Where are we at on that as a transmission risk?
I think we're focusing on the more common expected forms of transmission, which are, droplet spread rather than more airborne or aerosol transmission. Certainly, when we look at the healthcare setting, any situation in which aerosol generating procedures are undertaken, there's great attention to making sure that everyone has necessary PPE. So, we know that there are risks, but our focus remains on, making sure that we're considering the more, traditional or common means of transmission, which would include droplets, respiratory spread.
Thank you.
Our next question comes from the line of Catherine Rickert from Minnesota Public Show. Your line is open.
Sure. So over the weekend, we were hearing that Walgreens had an appointment snafu in the sense that you could go on, try to make your first appointment, but then you wouldn't be able to make your second, and some people weren't able to make appointments at all as a result. There was some sort of disconnect there. Did anyone get their shots through Walgreens over the weekend? Have you guys figured out what was going on there?
Chris, can you?
Yes,
Yep.
Yes, we understood that there were some challenges actually with details from all of our pharmacies. There were, little hiccups, but understood that Walgreens was still able to vaccinate. The challenge there is that the doses that were made available through Walgreens were a one-time only in the retail setting. And so, any hiccups that were identified were for that one week in time vaccination, if you will, whereas with Thrifty White and with Walmart, there were a couple of things that we worked with them on, and they were able to make some changes going forward because they will be continuing to offer vaccines in those settings.
So I just want to be clear, if you got one shot through Walgreens this past week, will you be able to get a second shot?
Yes, you will definitely be getting your second shot.
Okay. And do you know at this point what percentage of Minnesota educators have been vaccinated? And do we have any sort of regional breakdown of that? Like, do you have more teachers in rural areas than metro areas having received vaccinations so far?
This is Jan. I'll start. I don't know if Chris has any more granular data. I know that we're trying to compile a lot of that data from several different vaccinator streams or channels, as we've described that whole ecosystem. So we know certainly they have more precise numbers on what the state-sponsored sites have done, but also some healthcare providers, some pharmacies, some local public health. And we're trying to gather up a more comprehensive picture of what percentage of child care as well as educators are complete at this time. I don't have that for you right at this moment, but we are working on it.
Yep, and I would say that what we know about vaccination overall is that there's been more vaccine delivered in greater Minnesota based on population than in the metro. So it's entirely likely that differential may be true for educators and child care as well.
Okay, thank you.
Our next question comes from the line of Steve Karnowski from Associated Press. Your line is open.
Yeah, hi. The White House told the governors this morning that it's increasing vaccine supplies that are being sent to the states and also for the separate pipeline to the pharmacies. Do we know yet what that's going to mean for Minnesota?
I think there are a couple of different things going on. There's also, an additional development. We all have been hearing about the 6 doses that are available in the vials of Pfizer vaccine and how those are to be accounted for. So there's some moving pieces to the numbers for next week. And as well, I just have to flag, Chris mentioned the weather impacts that could affect this week's, the delivery of this week's allocations. So I don't think we have very clear line of sight to all of those impacts yet on next week's numbers and how this week's delays might even affect that.
But we do expect that we will be getting a bit more vaccine based on, as you said, the federal government providing states with more vaccine. But it does have to be taken in light of the context, as the commissioner said, that they are now counting every vial from Pfizer as having 6 doses, when in the past they were only counted as having 5. So some of that increase is on paper because our providers were working to make sure that they utilized every single dose from a vial anyway. So just to clarify that aspect.
Thank you.
Our next question comes from the line of Sue Kraft from Manoman Pioneer. Your line is open.
Hello. I hope you can hear me.
Yes, we can.
Okay, this one might be a little bit different, but organizations planning community events here in upcoming months are talking about potentially having dances as part of their activities. And I didn't know how that would be. Well, obviously there's people that are getting the vaccine and that, but how would you make dances safe, or is that even advisable at this time? And of course, also thinking in terms of the kids and their proms upcoming.
Well, that's a really interesting question. I do think, we've got some different trends kind of all playing in different directions at this point. We are not yet at the point where we think that large gatherings with close contact are advisable. We don't know how much that might change in the coming months, but I think while we really appreciate the idea of making vaccination a celebratory thing, a dance to go with it might not quite be indicated yet. And in terms of what's the situation will be like in the spring, we're just going to have to wait and see what's happening with case levels at that point. We are very encouraged by where things have gone in the last number of weeks, but we just keep having to come back to staying vigilant and making sure that we don't let COVID get back in the game, especially with these new variants. So we will keep updating our guidance as the facts on the ground keep emerging. But I know everybody's eager to know the precise time at which some of those fun activities will be okay again, and we're just not quite to the point of being able to forecast that yet.
So a dance would not be advisable in the next couple of months.
That's right.
Okay, thank you for that confirmation.
Our next question comes from the line of David Colburn from Timber J. Your line is open.
Thank you. In the governor's announcement about relaxing some of the standards last week, the word gymnasium was included, and our local coaches in this area have had their phones ringing off the hooks trying to find out if they can get into basketball games now. What's the status of the guidance for youth sports at this point? And do you foresee any potential change between now and the end of winter sports seasons, or will we be looking at spring sports for possible revisions?
I think the reference to gymnasiums was literally workout facilities, not for spectator sports. I think the capacity restrictions still apply there, but in terms of youth sports guidance, Chris, anything else that you would say?
No, I was going to give the same answer. So yes, gymnasium was used because there were some fairly rigid guidance for gyms and other workout facilities, and that was relaxed, but not as it related to attendance at youth sports.
So then to follow that up, do you anticipate any potential revisions given that the numbers are getting better and that we've got the testing going on in the schools now with staff? Are there any possible revisions you're considering between now and the end of the season, state tournament times?
You know, I think we always continue to look at the emerging data, but one of the prior questions was about the new CDC guidance, and it was pretty notable that the CDC very, very strongly says we need to prioritize in-classroom learning above extracurriculars, you know, and that certainly is very highly related to the level of case activity that's just prevalent in the community. So, and we keep on, I know, repeating this over and over again, but we have had such a great improvement since the big spike in the fall, and that is a huge relief. But we're still at quite high levels of viral activity. So it's all relative. We would have considered the case levels we're at now to be extraordinarily high back in the summer. So we're coming in the right direction, but we're still very close to those thresholds of concern when it comes to case levels per population and hospitalizations as well.
Well, and Commissioner, if I can just add that, you know, as I spoke in my comments, I mean, we're seeing variants that are circulating in Minnesota, and we want to make sure that we're doing everything to limit the transmission of these variants. They are more easily transmissible person to person and likely cause more severe disease. And we want to make sure that we keep our numbers low so that we can have the advantage of the vaccines that we have. So it's really important that we, you know, celebrate where we're at, but we do not move too quickly, because, you know, we want to make sure that we are not giving a foothold to these variants.
Our
Operator,
next
we have
question.
time for one more question.
All right, sir. Our next question comes from the line of Kate Raddatz from WCCO. Your line is open.
Thanks for taking my questions. Earlier this month, when you talked about the vaccine rollout forecast, we were talking about how it could take 16 weeks just to vaccinate all of the senior population in Minnesota. Dr. Fauci was on this morning saying he thinks it could be May or even June when the vaccine is more widely available to the general public. Has our timeline changed at all, or do you have any reaction to the comments he's made in the last couple of days?
Well, this is Jan. I'll start, and certainly welcome Chris to chime in as well. As we've been saying, the increases that we've seen in the supply, though they've been incremental so far, they've been steady, and the federal confidence that the supply chain will open up further is certainly welcome. We have not formally updated our forecasts of timelines, but we certainly look forward to the fact that it does seem that we can plan an acceleration of the timeline just as these supplies continue to build a little bit. But it is something that we just have to kind of watch a couple of weeks at a time to make sure that those increases in production really, can be realized to the degree that the federal government is hoping for. But they certainly are forecasting to us that we can and should be planning for more robust supply, which is good. That's why we have built out this ecosystem with so many different vaccination points, so that we can be ready when the supply increases more rapidly. Chris, anything else?
No, I mean, we're very encouraged by the statements that we're hearing from the federal government about increased vaccine supply. And I do want to just acknowledge, and we talked about this, I believe, last week, because Dr. Fauci had mentioned April, I believe, as open season for vaccine, which was also, an encouraging comment. But just as the commissioner said, we have a diverse vaccine ecosystem, And that system has the capacity to handle many, many more doses per week than we have been able to provide. And so we look forward to the weeks ahead when we'll be able to have many, many more people vaccinated in Minnesota. But at this point, we are still working our way through the priority populations.
This has been a WDIO News Special Report.